Today we will talk about the programs and services of learners with communication disorder. The growth of special education in the Philippines has been given a relatively good support all these years both by the government, non-government organizations and stakeholders in response to the needs and challenges of the times. The Magna Carta for disabled persons lacks specific provisions for children with language problems. Major barriers to successful implementation include lack of awareness and understanding of the rationale of policies, accessibility problems, and limited financial coverage of services. Are you familiar with DepEd Order No. 44 Series of 2021? It is known as the Policy Guidelines on the Provisions of Educational Programs and Services for Learners with Disabilities of the K-12 Basic Education Program. Paragraph 1. The Department of Education, DepEd, issues the policy guidelines on the provisions of educational programs and services for learners with disabilities in the K-12 Basic Education Program. Paragraph 2. The enclosed policy guidelines shall provide an overall direction and guidance in the organization, management and implementation of appropriate program, services and interventions for learners with disabilities. Paragraph 3. Effective school year 2021 to 2022, this policy shall be implemented in public and private elementary and secondary schools. However, private schools may contextualize the necessary provisions depending on their needs and context. An educational programs and services refers to any educational interventions, programs and services that will ensure support to learners with disabilities for an equal opportunity to access quality basic education. In the provision of educational programs and services for learners with disabilities, the range of programs and services shall be available in the school to address the needs and learning preferences of learners with disabilities. These programs and services are presented in the succeeding sections. In identification and referral process. Prior to the identification and referral process of learners with disabilities, teachers need to conduct the child find or child mapping activity in collaboration with the local government unit/barangay officials during the early registration. The mechanism and procedures for child find or child mapping shall be issued in a separate policy. Special education program is an avenue for learners with disabilities to realize their right to education. Learners for SPED program are identified through the following process. 1.1 Begin with recognizing learners who exhibit atypical needs as compared to their peers in the same chronological age. 1.2 The learners with atypical needs shall be provided with appropriate interventions. 1.3 The learners with atypical needs shall be referred to an appropriate specialist, who is either part of the ILRC or from the health center, division office, LGU, or other institutions which have allied and medical specialists like psychologists, doctors, etc., for assessment. 1.4 The learners with atypical needs shall be assessed and evaluated by an appropriate specialist using a variety of assessment tools and strategies such as Multifactored Assessment Tool, MFAT, and Early Childhood Care and Development, ECCD, checklist. 1.5 The results of the assessment and evaluation shall be the basis for placement in the learning environment and for eligibility to be part of appropriate programs and services. 1.6 All information about the learners being assessed shall always be treated with utmost confidentiality. Assessment service. Assessment is crucial for learners with disabilities not only to clearly establish the goals for their learning and development areas but also to continually monitor their progress in all domains of development, namely, the cognitive, socio-emotional, physical, motor, and moral-spiritual domains. Psychological and multidisciplinary assessments shall be accessible to LWDs so that specialized evaluations of their strengths and weaknesses can be established and/or monitor. LWDs shall participate in national assessments following the accommodations. The progress evaluation of learners with disabilities shall be based on his/her individualized education plan and individualized transition plan goals. The progress report of learners with disabilities shall maximize the use of the attached progress report forms for LWD. Adaptation of the K-12 curriculum for learners with disabilities. The K-12 curriculum offers various educational opportunities that are redevelopmentally appropriate for learners and are based on their interests, strengths, and needs. Ensuring that it is learner-centered, contextualization and adaptations of the curriculum shall be made in favor of the learner. 3.1 Essential adaptive curriculum is designed to help learners with severe to profound disabilities develop their skills in managing school and day activities. 3.2 Curriculum content adaptations are made based on the abilities and unique requirements of the learners with disabilities. 3.3 Transition skills and competencies develop and improve life and career skills, socio-emotional skills, and pre-vocational and livelihood skills. The transition program and other related services shall provide LWDs the bridge from one phase, location, or situations to another to help them adjust. 3.4 The K-12 Bulk Education Curriculum for the Alternative Learning System K-12 can also provide opportunities to develop basic and functional literacy skills for learners with disabilities. Development of an Individualized Education Plan IEP. Every learner with disability shall have an IEP that articulates his/her learning goals based on the K-12 basic education curriculum. The IEP may also include goals that prepare the learner for the K-12 curriculum and the transition program. All persons involved in the program shall ensure that it is carefully planned, constantly monitored, and reviewed periodically to ensure the learner's progress towards the realization of the agreed goals/performance. When it regards to resource room services, all schools with learners with disabilities enrollment shall have a resource room except those with or served by ILRCs. The resource room is intended for additional support services that include the following: specific instructional interventions, and other related services outside of general education classrooms such as SPED teachers' instruction on essential skills art competencies after class hours, during vacant periods or during classes, when necessary. Therapy services in partnership with available service providers. Tutorial or remedial sessions for learners with disabilities who display difficulty in achieving the expected instructional goal/S and for learners who are at risk of failing. Assessment services area for learners with disabilities educational placement and referral. Adaptation of learning resources (OD ICT). Adaptations in resources are essential in ensuring all learners with disabilities can participate fully in ATL learning experiences in schools and in communities. Learning resources shall be aligned with the curriculum standards. These adaptations shall be through teacher-developed materials or assistive devices and technologies. ICT can also support learners with disabilities. Educational placement. The inclusion of learners with disabilities in TRE general education classroom varies depending on their unique needs and other requirements. The following are the suggested options for placement. Full inclusion. The general educate low classroom learners with disabilities shall be in full inclusion if they can cope with all the required activities with the necessary instructional support within the general education classes. Part low inclusion with resource room services. Learners with disability as who shall be in the partial inclusion are those who can cope with at least 50% to 75% of the required activities in majority of the learning areas. The self-contained class is exclusively for those learners with disabilities who are diagnosed or identified to have severe to profound disabilities. They are the non-graded learners with disabilities or those who are in the transition program. The 8th is programs. Every school, through the school head and teachers, shall be proactive in initiating, designing, and implementing appropriate programs for learn other than the existing programs. The gifted and talented program shall no longer be under the special education program. It should be classified under the special curricular programs that shall be implemented from grade 4 to grade 10. A policy on GT/special curricular programs shall be issued separately. Likewise, the Head Start program shall be gradually phased out beginning school year 2021 to 2022 onwards until the last batch finishes the program. 9th is program delivery. Schools shall provide special education program to LEAR in different delivery modalities or options. The instructional delivery shall be based on the learner's A. residential distance on the school, B. family structure, C. health condition and or D. other factors to be determined by the school officials. Thus, the program delivery options shall be any or a combination of the following. School-based. The learners with disabilities may receive instruction within the school setting. They are handled by a special education teacher and or general education teacher. Community-based. The learners with disabilities receive learning instruction within the community in a designated place. Classes are conducted in community facilities like barangay hall, spiritual places, or other places available. A special education teacher and or trained community volunteer teaches the learners with disabilities. Hospital-based. The learners with disabilities who are under intensive health supervision of medical specialists receive instruction from a special education teacher within the hospital premises where they are confined. Home-based. The learners with disabilities receive instruction at home or at an orphanage structure. A special education teacher together with the family members or trained volunteers teach the learners with disabilities. Program management. The following describe the program management roles and responsibilities at the different levels of governance of the Department of Education. School level. Schools are the primary implementers of the special education program and other interventions for learners with disabilities. It shall foster a healthy, happy, and engaging learning environment that is inclusive and rights upholding. Division level. The School Division Office shall capacitate, support, and empower schools in achieving and maintaining a healthy, happy, and engaging learning environment for all. Regional level. Ensure the rollout of special and inclusive education programs and services in all its division offices in the region by providing technical support, capacity building programs and provision of resources. National/central level. Provide overall direction and guidance to low policy formulation and standard setting for special education program and services for learners with disabilities. In monitoring and evaluation. The monitoring and evaluation of the special education program and services for learners with disabilities shall be in accordance with the Basic Education Monitoring and Evaluation Framework. The department through BuildSID shall develop and implement monitoring and evaluation tool in collaboration with relevant bureaus and OIFISes in DEP Central Office, especially the Education Facilities Division, for monitoring the accessibility of school buildings, etc. Regional offices through Curriculum and Learning Management Division, CL&D, and division offices through the Curriculum and Instruction, CID, shall conduct monitoring and evaluation at their level to ensure that support systems are in place in the implementation of special education programs and services. Thank you for listening. Sincerely, Ray Marie Salilo Amansek.